Hello, everyone. My name is Dilorom Sultamuratova, and today I and my groupmate Zhanna, Zhuldyz, and Nursaya are going to present the case of New Zealand and its success story in dealing with pandemics. To start with, I want to look at the outline of the presentation. We're first going to go over the case of New Zealand as a state and its general fight against the pandemic. And then we're going to dive into the sociology of COVID-19 fight. And at the very end, we will come up to the long-term perspectives of the fight and the lessons that can be learned from that. To start with, let me ask a question. What do we know about New Zealand? Some fans of Lord of Rings and Hobbit trilogies might think about the famous location that you can see here about Maori, minority, maybe national rugby team, or just this picture of islands. But other than that, New Zealand is also famous for its strategy to fight the coronavirus, which we're going to discuss here. The very first case of coronavirus was dated back to 28th of February 2020. And in fact, that was perfect timing that helped New Zealand to prepare for and avoid an exponential growth of the virus, flattening the curve. Instead of the planned influenza fight strategy, the state of New Zealand decided to use elimination strategy because New Zealand understood that coronavirus is much different from influenza. That's why it is better to reduce the incidence of disease to zero. And that was in fact very much different from the strategies that other states employed, because other states wanted to develop herd immunity, but New Zealand went hard because they say go early and go hard. And they used a 4-level response framework. So in the first one, all businesses are open, everything is pretty free to use. In the second one, you can connect with friends. And the third one, the bubble strategy, is introduced, where you can extend your bubble only to your close family members. But in the fourth, last bubble, no movements. The bubble should be kept really, really small, and all the restrictions are very, very strict. Despite the fact that it had a risk of having negative economic and employment consequences, New Zealand decided to do that. According to the finance minister, Grant Robertson, going hard and early means that we can come back faster and stronger. That is why, according to the early forecast of the National Statistical Agency of New Zealand, the expected recession of GDP was about 16%, but in reality, the GDP fell just to 12.2%, which is still high in comparison to its neighbor Australia. So according to OECD report 2022, the impact of COVID-19 was detrimental to the flow of people and products, because the borders were closed. That's why the trade was disrupted. That hit the industries as tourism and hospitality. So talking a bit more about the economy that was harmed, we should think about the fact that New Zealand is classified as a service economy with a productive agricultural sector. In many sectors, the production of goods and services was reduced, and from the earnings perspective as well, incomes of people were significantly reduced. Employment in tourism, hospitality, and retail couldn't effectively shift to online platforms. In addition, many small businesses were caught unprepared for digital operations, and their premises were required to stay closed during the lockdown periods. As a result, they found it very much difficult to establish an online presence. And right here, when we're talking about the consequences of the COVID to the economy of New Zealand, it is also important to mention the pre-pandemic economy of the state. And here we should state that New Zealand was quite wealthy state, because after the crisis in 2008, it experienced only the growth in its GDP. Had in 2019, according to OECD report, it has historically low levels of unemployment, and also it had high levels of employment, because most of its labor was highly skilled, and compared to other OECD states, the majority of the population of New Zealand had a higher education. That's why they didn't have any economic problems. Also, compared to other OECD countries, New Zealand had a fiscal budget surplus among the privileged few in the OECD countries. So it proved to be imperative in allowing the government to provide relief policies, including wage subsidies and tax deferments. As a part of the elimination strategy, the government introduced an economic package to support businesses and employment. So the logic between the strategy was to keep the population safe while protecting livelihoods and the economic activity to the greatest extent possible. That is why, according to the latest OECD report of 2022, the economy rebounded quite quickly. After the summer period of 2020. So at the end of 2020, the economy already experienced a positive impact. However, everything is not that perfect, because there was an increase in cases in 2022. Because increased cases meant the return of some strict regulations and policies, but people, in fact, were quite tired of all of that restrictions, and some people even couldn't find a job because their jobs were qualified as non-essential, and they needed to stop working. And actually, according to the class reading by Schaffer on necroethics of late capitalism, certain occupations declared from early on in the pandemic to be essential for staying open, but the others were closed. So people were very much angry to the current Prime Minister of New Zealand about the return of cases, about the return of restrictions. That is why they had a lot of protests. So this fact shows that the increased restrictions are effective, but at the same time, they affect the freedoms and the rights of people to stable income and working rights. That is why here we should look at the bigger picture of the pandemic, not only limiting ourselves to the employment and economic freedom. So from now on, I give the floor to my group mate. Thank you.
Thank you, Dilorom. Now let's move to the digital world. And the lockdown has once again highlighted New Zealand's digital divide, with households across the country not having access to computer devices or the internet in general. And let's have a look at this table. In 2018, there was a small proportion, which is approximately, as we can see, 1.1% of the household that had no access at all to telecommunications. Among those participants of the New Zealand census, 92% approximately had access to a cell phone, and 86% had household internet access. So, but even if the rates might appear fine, there still was digital inequality. And another aspect of the digital divide in New Zealand is a strong connection to household income, with lower levels of access and lower household income being concurrent. I believe the reasons why government was stressing the importance of the digitalization and funded it heavily are clear. Digitalization of the whole country as much as it was possible was the way to deal with pandemics in general. And as we have read the article, which is called Digital Inequality Exacerbating the Divide previously during the course, author stresses the importance of the digital inclusion during the pandemic, highlighting the problems that people faced when they were either isolated or in their bubbles, which is the case of the New Zealand. So it was internet and access to telecommunications was their way to communicate, study, order things, even to see a doctor and get medical treatment. Because as we can see from this cartoon, New Zealand has a system of healthcare which is digital as well. In this context, the remedy for this issue is often referred to as a digital inclusion, and it is defined as creation of opportunities so that all groups can participate equitably in society using digital technologies. And even though the situation might have got worse during the just the start of the pandemic, since the government was not fully ready to respond it's getting better from day to day. So they have established a project which is called Digital Government, and it is created to better meet the needs of New Zealanders in a modern world. That is why they are funding heavily digitalization. And there are already positive results from the program that we can see already from this slide. Those are intermediate results, and in general a lot of money is allocated to achieve those goals of digital inclusion. Also, we can see those when we follow this link, which is the map of digital inclusion. I have already opened 3 tabs, but it's fine. So here we have a map uh, which is provided by the government regarding the results of the digitalization programs. Here we can see places with computers, with wireless Wi-Fi, free spots, and hubs where people can access internet. So society moved to online mode, and they were doing this successfully. That in turn led to the success dealing with the virus, which was spread offline. In the long run, pandemics has positively affected the digital inclusion programs in New Zealand, making it going faster, which was obvious from the presented intermediate results. And hopefully, already in less than a decade, they will be able to cover everyone in the state, as New Zealand government plans to do so. Moving on to another very important aspect, which is identity and pandemics, I would like to start from saying that nationwide outbreak changed society as we know it, and mm, this in particular have tested the strength of national identity of New Zealanders, as they came together to be one of the first in the world to significantly slow and stop its spread. This brings us to consider what constitutes the New Zealand identity and the positive and probably negative implication that this nationalism has brought about its response to COVID-19. And when it first came into play, it was hard nationalism for New Zealanders. They united together and were prepared as national citizens to follow state orders and to do what was required for the health of the whole nation. According to the research over here, we can see it. Uh, it was known that, according to the survey, that in the first 2 weeks of lockdown, people were expressed high levels of patriotism, institutional trust in the government, police, health authorities, compared to the results of a control group surveyed in 2019. So they had high trust in science, patriotism, and even psychological distress. Also, media coverage at this time significantly contributed to this sense of community and patriotism. Throughout the country, there were diverse daily news conferences broadcasted, instructions, and etc. And as we remember from the article by Trank and Davis, which is about the bubble policy of the New Zealand, we can also see how it affected New Zealanders' identity, national identity, and the feeling of responsibility. And this is one of the videos spread on social media and television. Let's watch it together. So people were thinking as their communities, and as I can even put in their imagined communities as bubbles, which obviously enhance feelings of responsibility for each other, for lives of other people. That's how it goes. So this is just one of the videos that was spread via internet and television. And Jacinda Ardern referred to New Zealand as a team of 5 million, actively interpolating every individual as a national subject. In many ways, COVID helped to strengthen the New Zealand national identity, and this may prove pragmatic, particularly in the future, if more community cases arise or they face a completely new calamity. Probably from the other side, it has also created this division between New Zealanders um, and the outer world, or us versus them scenario, and we will be talking about this later in the presentation. And in the long term, it's obviously going to have a positive impact on the state, since high patriotism and feelings of nationhood, in some sense civic nationalism, are the fundamentals for the prosperous state, and this no doubt have led to the success over the pandemics as well. Um, Also, I have stated about the trust in government and politicians, which I believe is going to rise at the end of the pandemics, because despite the protests happening in New Zealand, about which my groupmate Nursaya will later talk about, um, this trust is going to rise anyways in the future, and support of citizens. because the first protest happened simply because they were too tired of this restrictions, while the second wave of protests did not occur actually, and there were not so much protesters outside because people trusted their government and understood their decisions and actions. So identity has changed for the New Zealanders for the better. Thank you.
Thank you, Zhuldyz. Hello, everyone. And I would like to focus on the COVID-19 impact on education as well as government-people relations. Um, well, the education system was in New Zealand was under pressure after an increase in cases across the country. There was a need for rapid changes and actions in the system, and of course, the introduction of technology in the learning process. However, as it was revealed through the OECD report, the graph you can see here on your screens, New Zealand already had a higher rate of technology use even before the pandemic. According to the Teaching and Learning International Survey, TALIS, shortly, New Zealand demonstrated high use of information and communication technology, ICT, in the learning and teaching process. Namely, if we would speak in terms of numbers, 80% of teachers frequently utilize and allow their students to use technologies for educational purposes, contrary to 53% on average among OECD member countries. Insufficient access to the internet was reported only by 3% of principals, as opposed to an average of 16% for other OECD countries, which is relatively low number. What about the measures the government took? Well, to coincide with the March level 4 lockdown, the Ministry of Education brought forward the April school holidays by 2 weeks. Students went into lockdown in their family bubbles, which were discussed by one of our readings by Trinka and Davis. And after the Ministry of Education approached every school in New Zealand to check their readiness for online learning, they found out that about half of all the households were not connected to internet or lacked devices for online learning. This was stated by Chris Hipkins, Minister of Education, in one of his press releases. However, the implementation of the Digital Inclusion Action Plan, which was mentioned by Zhuldyz previously, allowed to decrease in the number of households facing ICT problems. Um, Minister Hipkins also proposed other options of learning that helped to continue the studying process despite the lack of access to technology or the internet. He wanted all families to have at least one education delivery option, and his strategy includes four propositions. The first is to increase access to the internet and provide devices. This was the major one. The second is to deliver hard copy learning packs. Third is to present learning via two television channels. One is in English and the second one is in Maori language. And the last is to make a variety of web resources available for teachers and parents so they can help their children to study. What about the communication between government and public? According to McQuire et al., society is very sensitive to messages during critical situations, which means that to communicate with people is essential for the government during hard times such as COVID-19. Oxford COVID-19 government response tracker reported that New Zealand achieved the highest country score in the government response stringency index. This was done by very fast and confident actions. The communication strategies of well-known Premier of New Zealand, Ardern, at the beginning of the COVID-19 spread were very clear and very logically incorporated. She sounded the alarm early in March, and right after that, she announced a series of restrictive measures that turned into a national lockdown. She explained the purpose and necessity of the restrictions, which was essential for the society, according to Parker. Jacinda Ardern communicated with people mainly through two paths. The first is parliament speeches, and the second is Facebook Lives. The first method is seen as more formal, more official, and the latter method is characterized by an informal, relaxed tone, according to McGuire et al. I would like to show you the fragment of the video so you can have an understanding.
So forgive me for that. I do just want to prepare everyone that because of the lag with COVID-19, the time from someone having contact with someone who has it, catching it themselves, them being symptomatic and being tested and positive, there's a number of days before all of that happens. So we won't see the positive benefits of all of the effort you're about to put in for self-isolation for a few days yet, quite a number of days. I'd say at least 10 days. So don't be disheartened. Our numbers are going to go up. And the modelling I've seen suggests that they will go up quite considerably. We'll see quite a steep rise. In fact, I'm expecting we may see several thousand cases over a period of time until we then will start to, we hope, see the effects of what we're doing with self-isolation having a positive impact. So don't be disheartened when you see that. Don't be disheartened when you see that ongoing increase because of that lag. All of the efforts that we're putting in should eventually show if we all follow the rules.
As you can see, Jacinda Ardern is talking about reality and real predictions that could happen after some time. And at the same time, she tries to calm people, and this trustworthy and honest discussion with community really makes them hope. Well, another point I would like to mention is the population consistency, which helped to overcome COVID-19. That is, New Zealand is located in a region prone to earthquakes, as you may know. Thus, community and emergency management systems are always ready to respond to such natural disasters as earthquakes, according to Jeffries et al. And New Zealanders are used to following these regulatory policies in case of emergency. Thus, this enabled government to effectively regulate the population and to kind of wake people up so that they can comply with restrictions and care for about people around and about themselves. And probably in the long run, New Zealand improve in online education system creates opportunities for, of course, quick response without affecting the good quality of education. And also the success of these restrictions implemented by government, by federal representatives, as well as this honest and effective communication with society, lead to an increase in public support already, public support for the government, which was reported by Jeffries et al.
Thank you, Zhanna. Now I'm going to talk about the last part of our presentation, which is vaccination and treatment of minorities, where we learn about the criticisms and the flaws of the New Zealand government. With a bit of pretext, vaccination rollouts before the pandemic were quite low historically, but since the 2000s, the government have been actively trying to increase it. For example, they introduced a national immunization register, which is the digital portal to track vaccination rates. They introduced online handbooks on various diseases, and they kept increasing the range of free vaccines for the public. With these efforts, they increased the share of fully immunized children from 56% to 93% in recent years. Moving to the COVID-19 period, this is when the largest mass immunization program in its history was launched. Once vaccines arrived, they set up large-scale vaccination clinics and priorities were assigned. The first groups were border workforce and their households because they interact the most with the international community. Then healthcare workers, then old people and high-risk groups, and finally the remaining population. How do they encourage the population to get vaccinated? For example, there was a 90% project, which was symbolic because the limited capacity of the healthcare system required the exactly 90% of the population to get vaccinated in order to avoid the collapse. They also used cartoons produced by local artists to promote vaccination in a simple and yet clear way, as we learned in the chapter about blowing bubbles. Besides simple encouragement, they also introduced workplace mandates and My Vaccine Pass. It is a smartphone app. This is the general enforcement timeline. At first, it was only mask mandates and quarantine and tracer apps, but then, as we mentioned earlier, the app was launched and vaccine mandates were introduced. Although it was very effective with increasing vaccination, as you can see, 80% in November and 90% in December, it caused people to protest against vaccine mandates. And this was quite alarming. The 2020 survey actually showed 74% of people supporting the vaccines, and the remaining 26% of people were concerning, and their fears were based on the fact that the COVID-19 is novel, and the worldwide growth of conspiracy also contributed. So the protests began, and they would grow gradually. For example, in February 2022, we can see that protesters are relatively peaceful, and the New Zealand government is also trying to pacify them even more by turning on various playlists like James Blunt and Baby Shark. However, by March 2022, the Wellington protests began to grow violent. There were citizen-police clashes, tear gas and fire involved. Causes of escalation are the fact that protesters used media attention to amplify their messages. As we learned in the Toxic Wild West Syndrome chapter, protesters are usually loud, self-centered, and they get more media coverage than the compliant majority. Also creates a favorable soil for extremism. People that initially come only to oppose vaccine mandates get exposed to all sorts of extremist ideas, and they eventually get convinced that they need to act violently. Another criticism of the New Zealand government, besides the strict regime of mandates, is the disproportionate damage caused to Maori people. They made up more than 50% of the infections in the country and experienced higher fatalities. According to the social context, they trust the government less due to the historical racism, which is shown in the lowest immunization rates in the last few decades. The same is with the COVID-19 vaccines. Less than 50% of the Maori people were vaccinated at that point. Among the structural context reasons or objective reasons were the fact that their life expectancy is half that of white people. So the 40-year-old Maori representative faces the same COVID-19 risk as a 70-year-old white New Zealander. They are also structurally subject to higher poverty and poorer health. The Maori leaders also reported of the government's discrimination in drafting the COVID-19 policies. For example, no priority was given in vaccination to indigenous groups, as we saw earlier with priority groups. They did not cooperate in convincing the Maori people to get vaccinated. They concealed data about vaccination rollouts among this group. And they also suggested to open borders while Maori people were largely unvaccinated. This was when they achieved the 90%, but the majority of Maori people were in the remaining unvaccinated 10%. So it was not distributed evenly across ethnic groups. Eventually, the Maori leaders sued the New Zealand government and they won the case. They also compared it to Squid Games, where the marginalized and poor groups in this TV show were getting killed because of the elite's decisions. Nevertheless, we know that the New Zealand government is a proactive one. By early March, the government contributed to increasing the vaccination rollout of Maori people to 84%. And mandates could finally be lifted because now 95% of the population was vaccinated, and it was more or less even across ethnic groups. They finally announced themselves ready to open their borders and greet the world after 2 years of fighting the pandemic. In the long-term perspective, we can expect the vaccination rollout to keep increasing to 100%, hopefully. And we can expect the government to always take timely measures whenever it faces an issue. However, we might also need to add that since they opened borders in the last few weeks, they experienced a huge increase in the number of infections across the country. But this is logical because borders were closed and people were not getting infected, and now they are all getting infected because borders are open. I would say it is inevitable because the virus needs to be caught by every person. The New Zealand population has to experience it and go through it. But it is safe to believe that because 95% of the population is vaccinated, they will still have the lowest death rates in the world. And this is why the New Zealand case is a success story. Thank you for your attention. Have a good day. Bye.